Since it's Sunday, and we're the last speakers before home, I thought it'd be fun to tell a little joke. But the last time I actually told a joke about cooking, nobody laughed. I guess it didn't pan out. So I have another one. I warn you. But it's great to see Sunday Smiles this morning. And I really appreciate Chef Gary Jones' perspective on Disney. I thought that was very interesting. Part of my role is also food waste management. And as a matter of fact, I think for anybody who works in food service today, I think that's where we're moving. We can't have a food service operation without considering food waste as just what we do every single day, not a special add-on program. So thank you very much for that perspective. All right, so I'm going to talk about teaching kitchens today. I wanted to talk a little bit about building a culinary medicine program, and then I started thinking about some of the other ways that we do teaching kitchens and how we use teaching kitchens to build culture in the hospitals that we serve. I work for Morrison Healthcare, and if you guys are familiar with that, I work in the hospitals that want to be the healthiest of the healthiest, or the most sustainable. And they focus on population health. They have a lot of different initiatives. And we have 1,000 hospitals that we work with nationwide. So I work with it used to be just a third of them. Now it's about half of them. And pretty soon it's just going to be what healthcare is today, which is fantastic. So I'm going to share a little bit about my experience with you. And today's objective is really to look at the 5 ways that a teaching kitchen can impact a hospital through healthcare food service. So it's not only about building culinary medicine programs, but that's ultimately where we want to end up. This is more about setting the stage to when you get to that point. So believe it or not, using a teaching kitchen can actually drive recruitment and retention. You can create excitement in your retail cafe. You can educate people in your cafe. You can facilitate any kind of engagement in the 4 walls or outside the 4 walls. And now, especially with virtual teaching kitchens, as many of you probably work in this area, you can expand your reach to vulnerable populations and populations that you have had a hard time reaching, or that you have community needs assessments and have difficulty just even getting to healthcare access. And not only does it provide learning experiences, but it absolutely builds and sets the stage for culinary medicine. So I'm part of the Morrison Healthcare Teaching Kitchen program. It's a team that's led by executive chefs and registered dietitians. We do have a chef RD who's there in the middle. I don't know why in this picture we're like petting the chef, but we are. It's a very weird phenomenon. I look at that, I think, But aside from that, that is Chef Jeffrey Quasha. He is actually on the board with the Culinary Medicine Specialist Board. He is not a speaker, but he is an excellent chef, and he does an amazing research and development, and he sends me to come speak about our programs, but it does take a team. So for us in Morrison Healthcare, the teaching kitchen is probably not any different than what you do in your own facilities for teaching kitchens. It's a place where we explore food, culinary, nutrition literacy. We want to positively impact food choices. We want healthy food displayed. We want the right ways of how we feel food should be handled environmentally, like root to stem. That's a lesson that we do. We employ all of these things into our teaching kitchen, but the most important thing is that active participation is a key difference. Many of you know, right? We got into the kitchen the last 2 days, and some of you 3 days, and that's where the magic happens. Like, that magic happens the second you're required to chop that pineapple, or you have to bake the amazing ganache tart that we all had to sample yesterday. And for some reason, that food just tastes so much better and so much sweeter when we prepare it ourselves. There's a little bit of love that goes into it, and you can't help but be proud. I know Brittany and I, we were partners, and we thought, oh gosh, we burnt the sauce. Then we switched pans so nobody would know. And then we had to hide the pan because it was burnt. Like the intern's gonna find it, Heather's gonna find it, someone's gonna find it. And then we tried to like pull it off again, but then they caught us. They're like, you need to add more vinegar because we know what you did. I'm like, okay. So then we did that. And then somebody had to blend it for us because we ran out of time. Okay, well, whatever. But then we got this sauce and she's like, taste it. I'm like, oh. And we're like, ooh, it's so spicy. Did we have to put all the habaneros in there? And we were like, just, okay, we're just gonna go with it. Maybe we'll eat somebody else's sauce. But at the end of the day, we put that sauce on our meal and it was the best sauce we ever made. We were so proud. And we made a pact actually to go home and send each other pictures of actually making it at home. So we're like, we're gonna make sure we follow through. So that's really the inspiration behind the Teaching Kitchen and really bringing that love forward. So I'm gonna just kind of let you take that feeling with you, but then I'm gonna kind of go through the logistics of everything. But keep that love inside every time we think Teaching Kitchen. All right, here's an example of what we like to do. I want to show you this Teaching Kitchen because believe it or not, it looks like a built-in Teaching Kitchen. This is a portable Teaching Kitchen in a university. All right, so with the exception of the chef station, the instructor station, that's actually a venue where you can slide a cafeteria tray and get meals through. And it just goes to show that any place can be transformed into a Teaching Kitchen environment. That happens to be at Bowling Green University, but it's any place can become a Teaching Kitchen. I was kind of laughing, I was telling somebody that a closet back in the back room of where we meet every day could become a Teaching Kitchen. So just keep in mind, don't be limited. Work with your partners. We're the creative team. So if you need help, let us help you think about it, just because we have industry perspective and I've seen it done so many ways. And I'm always looking for that challenge. We're gonna make a Teaching Kitchen out of a stick, 2 matches, I don't know, we can figure it out. So, all right, so these are the 5 target areas that I wanted to start with. Believe it or not, these are all opportunities for Teaching Kitchen. So you have your healthcare food service company. If your healthcare system or hospital partners with somebody like me, then this is an opportunity to really tap into them. Go to your partner, use them. That's what they're there for. That's what I get paid to do, to help my hospitals and my hospital partners be the best that they can be. There is a population health person, there's a wellness, there's a sustainability person. If you don't have any of that, you don't have the right partner. There is a number at the end of this presentation. You can come find me, shameless plug. But hospital staff and caregivers, another great opportunity. We can't forget about our cafes, our hospital communities beyond our 4 walls, and then of course, hospital patients in culinary medicine. And that's where everybody is in this lane. And I think it's fantastic. We've listened to so many great perspectives and I've met so many wonderful people who are doing amazing work out there. So let's start with the healthcare food service company, okay? So when we talk about your food philosophy and where we start, this is so important. Teaching Kitchens create the buy-in of your food philosophy. They also create recruitment and retention of staff. What did we just have? The great quit, right? The great resignation. I mean, trust me, I have some delays on getting food service programs off the ground because I don't have chefs to run a program. At Prisma Health, we have 15 hospitals. They want to start a Teaching Kitchen program. We're like, wait. We're hiring the right person. And so I think making those connections and those partnerships to get staff in, come find me if you have chefs looking for an opportunity. I love that. But a Teaching Kitchen, when people see this at an orientation or they see it with your company, I was at the Press Ganey conference as well as Sven, who's the speaker next after us. People want to sign up. They're like, I want to do what you do. That's awesome. So it always makes a great impression and it attracts new employees. So we also have a food, nutrition, and sustainability philosophy. It's about these main principles. Our food, it's not just patients, it's not just retail, it's just our food. It should be good, it should be wholesome, prepared well. It has a focus on healthy food, healthy people, healthy planet. We make sure that we source from producers of color, and we look for opportunities to make change where we can in DEIJ, and we follow these commitments to help build better communities with our hospital partners. So there's a little QR code to learn a little bit about our sustainability philosophy if you're interested. I know Sven is going to talk about Northwell, which they lead, and it's fantastic as well. But how do we get this to new employees who just walked in, and we expect them to have this passion, for this process? And it's so hard to just say, hey, this is what I think you should believe in this. Well, I've been doing this for 20 years. I believe in it. I drink the Kool-Aid, but how do I make somebody else do it? And so that's where at new manager orientation, this is actually at UC Irvine, we have them start. We say, it's day one, it's lunch. They show up and then they go to lunch. And we're like, you're going to make your lunch. And they're like, huh? What? I don't do that. And I'm like, yeah, you do now. And it's just a unique experience. And actually, we're using a retail concept. So we tie it all together. This is one of our cafe concepts. It's called Cluck Cluck Boom. It's like chicken salad chick. But we have chicken salad. We have all kinds of salads. It's like a teaching kitchen. And it goes all the way down to chickpea of the sea, which is a chicken salad made with only chickpeas. And so everybody gets a chance to see what it all is. They get to try it. They get to make different kinds. They get to choose what they want, whether it's in a salad or a sandwich. They understand how the concept's presented. Guess what? We just oriented them to our company in a way that was not just like being handed the handbook. And it makes such a difference. So using teaching kitchens to attract and recruit new people is incredible. And it also helps retain. We stopped doing this for a while. We started going to virtual like kind of foundational orientations. And let me tell you what we did. We lost a bunch of people. Nobody stays, right? We used to take the time and the money and the expense to do this, and we've returned to it because making people feel cherished and in attendance and present is incredibly important. And we see these posts all over the place where people are just posting about their experience, which is great. We had an opportunity to train all of our national nutrition leaders. So this was back when we were doing how many of you guys have been to the meetings in New Orleans? Okay, a few of you. We used to do these meetings in New Orleans for a little while at the Goldring Center for Culinary Medicine. We brought 40 to 50 of our nutrition leaders. They are regional dietitians who oversee 10 to 12 hospitals. And we took them to this class and we said, guess what? This is what we're going to do. We're going to do CMEs where you're going to learn about culinary medicine. You're going to take the course. The team let them take a course and they got to train. So bring your people, train them, give them the experience that you've been having at this conference. You can recreate it at home or at your home base. We also have a dietetic internship where we have an opportunity with 70 to 80 dietetic interns that we orient each year. Now, COVID has made it a little bit of a challenge. We were virtual for a good time, but we had some opportunities to work the dietetic interns into some sites that would accept them. But now our orientation used to be in person in Atlanta, but now it's always virtual for now, because we have so many, and this is just screen one of people preparing, but we have a partnership with HelloFresh. And what we do is we ship them a box for HelloFresh and we say, we're going to eat lunch today. On day one again, these kids, they're like, why do we have to cook? And people are afraid. They're like, what do we do? And this is after the lecture we give to orient them and say, go to your kitchen, find something that is about to expire and bring it back, and then 5 minutes, and then they go, it's their break, and they come back and they're like, here's my banana, here's my cottage cheese. And we ask them what they can do to save that food. And that's our food waste lesson. And then they come into their cooking lesson. And these are dietetic interns. They're like, I'm trying to go into a hospital and be clinical. I'm like, well, you're going to do this too. But it's so much fun. We have 2 chefs that work on creating this box. It gets shipped to each of their houses. They make the box. We eat it for lunch together. Everybody gets to show, and it creates loyalty to our organization and to the field like you wouldn't believe. And now it inspires our interns to think differently about where they want to go in their career path. And I think that's really important. So in healthcare food service, teaching kitchens provide also a measure of what right looks like in food. And I think that is an amazing tool, and it helps create consistency in the food that we sell. So what right looks like. As a chef, okay, chefs in the room, if I said, okay, I have 1,000 hospitals, I want every chef at every single hospital to send me a picture of the chef salad or chicken marsala, let's do that one, that you make on your patient tray and send it to me. How many different versions of chicken marsala do you think I will get? Yeah, 1,000, and that's not even an understatement. You will get, because sometimes you have multiple cooks on multiple days, right? So what right looks like and consistency is so incredibly important. And we're learning this because now we're looking at it and saying, hey, how do we elevate food service? How do we make change? So we have a culinary expo. It actually goes on the road, and there's a ton of chefs, and that's exactly what they do. They go in, we've gone to 22 different locations. We've had 1,200 chefs, managers attend, and they actually prepare the food and say, this is what your chicken marsala needs to look like. Everybody feel good about this. How are you all doing with this? And we have a booklet that shows how to do it. That's how we create consistency. And using a teaching kitchen can create consistency across your organization, across your hospital. If you're wondering why your patients don't like your food, look at your food, see what it is, do something. Use your culinary skills to help make that change and get people excited about it in the organization. There's another opportunity with that. We also do training videos for chefs, directors, and RDs on how to do a teaching kitchen. I kind of want to show you this.
Number 4, we'll demonstrate an entire teaching kitchen for your reference.
Good afternoon, everybody. Welcome to our teaching kitchen. I'm Todd Consilio, Executive Chef for Morrison Healthcare.
And I'm Jillian Riley, and I'm a registered dietitian.
So today we're making a fun, exciting salad, cost-effective and delicious.
It's called the Waste Not Shaker Salad. Shaker salads are a great food trend right now. It's all the buzz, so we're so excited to make a shaker salad today.
Yeah, so we're gonna go through all the points of the salad, how to make your own dressing at home.
And then we're gonna go into building your shaker salad. But first, Chef's got some knife skills to demonstrate for you.
When we have knife skills, we're using a cut glove. This helps protect your hand if you get cut, obviously. If you have one, great, please use it. I'm going to use mine today. So first thing we're gonna do is we have broccoli, believe it or not, and broccoli is a great product that is often wasted and not overly utilized.
Right. And what do we call that, Chef?
IDP. IDP is a program that was started by Compass Group. It means Imperfectly Delicious Produce. It is really a great product, a program in terms of not wasting things. If you see things in your grocery store that aren't so cute, you know, they don't push them aside. They need love too. Go in there, pick them up, let's use them. You know.
Right, so what do you do, Chef, when you see some yellowing on some of the broccoli florets? Do you have to get rid of that?
Absolutely not, absolutely not. Most people would, they wouldn't pick it up. Cut off the top, olive oil, salt, pepper, roast it in the oven. You have nice roasted broccoli instead of the yellowish, you know, thing they're gonna blanch off of.
And another great produce that we use for IDP is beet greens. Sometimes if you will see your beets at the store, they'll kind of be wilty or dirty. So we like to recommend just taking the beets and soaking them in some ice water for just 5 to 10 minutes because that really helps crisp them up. And my favorite thing to do with beet greens is either put in my smoothies. I just remove the stem and just tear them and put them in my smoothies, or you can put it in stir fries. But another thing I like to do with beets is I am really big into vegetable noodles. So I'm sure all of you have heard about zucchini noodles. So zucchini is a noodle, so a beet would be a boodle.
I think it is a boodle. I don't really know, Jillian.
How often do you boodle?
I think once a week now.
Okay, so I boodle a lot, so I have a lot of food scraps in my kitchen. So I take those and I just throw them in my freezer. And then when I'm going to make a smoothie, I just pop that little chunk in there to get some added nutrition into my smoothies.
Also, the stems of the beet greens, those can be used as well. You cut them up.
Okay, so you see, we do not leave teaching kitchens to chance. There is a training. And as a matter of fact, if we were to watch this video, you would actually see the rest of the video where they did what not to do. And you have them up there and the chef's like, and he's up there and she's like, she's like, oh, does anybody have any questions? Like not making eye contact. Why are the people dressed up in costumes? Yeah, I'm in there. I'm dressed up in a Wonder Woman costume. Okay, it's because when we do these trainings, a lot of people zone out in the trainings and we've made them kind of humorous to keep the attention. When we do the setup of the teaching kitchen, we actually have somebody dressed in a Space Jam suit, a bunny rabbit. He gets trapped underneath the tablecloth and you see like the whole setup is done and then he literally comes out. And so if you're actually paying attention to the training video, you're going to see these nuances and it entices you to continue watching them. So we took the cue of our videographer and we made it kind of fun. And there's lots of different things. Dr. Seuss is in there. We have a nurse, or a witch. She is a nurse, but she's dressed up like a witch. That didn't come out right, sorry. But she has a fork and spoon that's on my wall at home that I brought. Those really large ones. I don't know why I still have one, but I do. And she does a thing where she does her wand and she goes ching, and her fork and spoon is like this big, and she's like trying to get into like the little thing and try to get the salad out. So it's a lot of fun. We had some actors and some non-actors in there to kind of shake it up. So that gives you an example of how teaching kitchens can be used in hospital food service. So moving on to hospital staff and caregivers, we can engage caregivers in supporting patient food, which can help drive patient satisfaction. So I think one of the challenges is that our nurses, they love our patients. And that doesn't sound like a challenge, but it is. It is when it comes down to this. Honey, I know you don't feel good. Why don't I order you a cheeseburger? Why don't I order you a grilled cheese or maybe some French fries? I know that'll make you feel better, right? So they go around the food service program and they're making that patient feel loved. But when we think about they're here for healing and they're here for a reason, how do we, change that script? And the teaching kitchen can do just that. So you can put multiple teaching kitchen experiences into a hospital. It's connecting the food philosophy with the healthcare organization. We can do it in the cafe. That's an opportunity. We have nurses who come down. They don't often have time to participate. We do classes or hospital events. You can do it fundraisers. I live in Lexington, Kentucky, and one of the hospitals there, they did a physicians board meeting and they did bourbon pairing. I don't know how many bourbons you can pair in one meal, but that's what they did. And they paired it with several of the meal choices and everyone loved it. And they paid attention to eating broccolini and Brussels sprouts. And it caught the attention of the board as they decided where their future was going. Like, I think somebody said, hey, how do you get somebody to start a culinary medicine program? You go to the dean and you say, what are your patients eating? Are they eating the food? What's going on? That's a way to get the attention. Also disease-specific SMAs. I think the Culinary Medicine Specialist Board, the certification has opportunities to make money and use the certification as a means and as a tool for fundraising, for CEUs, for hosting, so many great opportunities. And I think it's really important enticing people and stakeholders with that teaching kitchen experience to help them understand the beauty of that. There's so many benefits to the participants, but in this particular case, what if we took that nurse who offered the cheeseburger because she has love in her heart, bigger than anything for her patient, and we brought her to a teaching kitchen experience and we taught her our farro salad, or quinoa in an amazing way, or the chia pudding that we had, right, for breakfast. Ooh, that's tasty. Who doesn't love that, right? And instead of bacon or a sausage biscuit or something that she orders for her patient, she says, oh my gosh, you have to try this chia pudding. It's so good. It's like a pudding, really, you know, you put some berries on there. It's so delicious. And now she's promoting patient satisfaction, or he is promoting patient satisfaction. The team is just on fire about what is out there, and that is how that culture switches, and it helps to support and drive the culinary medicine program. There's just so many ways. And then the other way is that we can actually use this as employee recognition and celebration. So I think that's a really neat way. This is at Novant Health, and we used their leadership decided that people who were doing an amazing job got to be pulled out of their places for the day. They got actually some staff relief to come in, and it was for employee recognition. And they came into this little room, and we did a teaching kitchen experience. We played music, we gave away games, we gave away prizes. And you know what? They were like, I don't care what I'm doing. I may be eating a pumpkin salad or making a pumpkin salad. It's, first of all, it's delicious. They didn't realize it could be so delicious. And second of all, they're out of work, but they're at work, but they're not at work. And it's fun. And that's all that matters. And then you're immersing them in that experience. This is at Mayo Clinic. We did a leadership meeting with them. It was so much fun. We did I don't know if chopped is the right way to say it, but it's the spring roll contest. It was a leadership team building event. Everyone's in their suits. They're like, what? Don't put us in a room and make us make spring rolls. And people were having so much fun. Now, it was varied. I was a judge. So you can see, I don't know if anybody is a dietitian who does. Sherry Mahoney, she's a dietitian that's in the academy. She's there on the bottom left. She lives in Florida. So she did a beach inspired one. So they had like all these ingredients. They had coconut, they had macadamia nuts. She took all the beach ingredients and she made like a beach spring roll, and it was actually quite delicious. So the creativity, there's one I didn't have room to put the picture on, but they drew a map. I don't know, with spring rolls, it was out of control, but it was very fun. People love it. They get inspired. They tap into food. It was pretty amazing. We also have industry best practices for staff teaching kitchens. You can see on the left, how many people have been to Google? Have you done a tour at Google? A few people. If you ever get a chance, it's an amazing place in Mountain View. They have something called the kitchen sink, and it's in their like cafeteria like space, and it looks like an Apple store, right? It's glass enclosed, and it sits in the middle of the dining area, and it's intended to teach Googlers how to make food at home, because their food is heavily subsidized. It's subsidized because we want to keep people at work. And so we feed them lots of healthy stuff, but then they go home and they're like, Hot Pockets, I'm calling out for pizza. And they want to make food that's healthy. And so they get to go to this class to learn about that. The Dan Abraham Healthy Living Center at the Dalk, Mayo Clinic, they have an amazing teaching kitchen as well. Okay. So number 3, teaching kitchens in hospital cafes. All right. So the hospital cafe provides an awesome location to feature lessons in healthy eating. We have an opportunity to support the hospital mission, and we can reach patients, staff, patient families in the community. So Cleveland Clinic, I think about that. I'm going to show you this particular one first before I talk about Cleveland Clinic. We work with Hackensack Meridian Health, and they have a strong antibiotic stewardship program. Their number one goal for us in a food service program is to reduce no antibiotics ever meats. That is their goal. They want to be 90%. Let me tell you how hard that is. I've been doing it for years, but we're getting there. The supply chain challenges with the pandemic made it a little bit on a challenge, but we kicked off this initiative simultaneously with their physicians' antibiotic stewardship program. So let me show you what it looks like.
First of all, I want to start by welcoming you all to my kitchen.
We're going to learn about our sustainable proteins. We're going to cook a nice healthy dish, and we're going to enjoy our creations. today what we're doing is we're featuring our first teaching kitchen for the Hackensack Meridian healthcare system, and we're going to be promoting the antibiotic-free proteins.
The quality of the product is unbelievable. What's even more important is that when we treat our patients, our customers in our cafe, we're not giving them any unneeded antibiotics.
We're making the transition to antibiotic-free meat and poultry because the emphasis we place on the health of our patient and also our team members, we think is the right thing to do.
And on average, a little bit over 2 million people are admitted into hospitals with antibiotic-resistant infections. Antibiotic-free meat was one that a lot of folks were hesitant to get into. We went to our partners, including Morrison's, worked with them to say, hey, this is something that we want, this is the direction that we're going in. We went out there and made it happen.
We have our antibiotic.
So that gives you an idea. So they set us up and they said, this is our mission. How can you make it happen? And we took this on what we call a Teaching Kitchen Roadshow, and we took it to all of their hospitals, and everyone had an opportunity, and it was served in the hospital for lunch, and there were signs up all about it, and we had takeaways, and everyone had an opportunity to know what the icons meant. And it's just a really great way to move forward. You can see we do these in the retail space all the time with stakeholders, with just our regular attendees, patients. We create teaching kitchen series they're housed on YouTube, but we give them to our operations teams to be able to roll them in the hospital cafes if they want that. So that's really cool. So teaching kitchens in hospital communities. So again, another opportunity for advocacy of hospital causes, supporting a wellness center, promoting community education, or even creating a farm to hospital experience. So here's a zoodle salad. We keep our recipes pretty simple because you see our training platform. We want to make sure we make a star out of every chef and every dietitian that comes up, and they're just amazing. People never cease to amaze me how once you give them some training and they just really shine in front of others. This group is actually at their annual Health and Wellness Expo that's sponsored by the local medical center, and they did it right in the middle of the whole entire expo, and it was a lot of fun. And this is in Kentucky, so let me tell you, zoodle salad, not so popular, but they worked it out. This is the rooftop of Cleveland Clinic. We picked this place on purpose because it's nowhere near a kitchen. It's a place where families go to worry. Families go up to the rooftop because it's gorgeous, and they have somebody in surgery for hours with something incredibly difficult to overcome. This particular young lady on the right, she's smiling. Her dad was in there for repair from a widowmaker heart attack. Less than 12% survived that surgery. And she was up there with her mom, and they were and she said, can I come sit in here? And I was like, yes, of course you can. Bring your mom. The mom didn't want to come. She wanted to listen from afar. But she sat up at the table, and all of the people up there using just the space to just hang out got to listen in, and then people came up afterwards and got to try samples, even if they weren't on the table, and we gave out recipes. I want to make that at home for my loved one. And so it's just a way, it's incredible. This one is from Ballad Health. We had Chef Val Arneson. She's a spice goddess. You may recognize her from PBS. She's a lot of fun. The Convention Center in Tullahoma, Tennessee has a big event. Ballad Health is our hospital that we support there. And we brought her in to do lentil cookies and spiced chai, and we had kids there, and they got to make the cookies, and they got to learn about spices and take spice packets home. So community events are really amazing. And then if you have not had a chance to go to Boston Medical Center, call me up because you need to go there. It's incredible. They have what I call the trifecta, which is where they have a rooftop farm, a preventive food pantry that protects dignity. Anybody can join. You can get food up to 2 times a month. Any doctor can prescribe it. It's incredible. And then they also have a teaching kitchen with real live feeds into their rooftop farm. And they combine this together to create no Disney, but it is a magical place for sure. And then, of course, we have virtual teaching kitchens because I think that's really important. And as our folks get out there, especially the cooking with kids, I think that's a really good one. We get actually our own kids to cook in the kitchen and other kids to kind of kick it off. It's a lot of fun. And this is free for anybody. You can go on there right now. We Eat, Live, Do Well. Put the we. If you don't put the we in front of Eat, Live, Do Well, it's like alcohol or something. I don't know why, but make sure you put that in there. And then last but not least, I wanted to talk about teaching kitchens in culinary medicine. And this is kind of where we get to the top of the Matterhorn, I guess, where we're like, okay, we can do all of these things, and then we can do this. And this is where we're trying to get those programs off the ground. And from my perspective, we have worked with a couple of teaching kitchens to help get them off the ground. We most recently spent about 1.5 years with a program actually at Yale New Haven, and we brought in thought leadership, design partners, planning, management. All of that took us 1.5 years. Staffing, we advised on staffing. Myself and another, the Compass Group teaching kitchen manager. Compass Group is our parent company. We worked together and we said, what do you need? How do we do this? We worked with the dietitian team. We worked with everyone. We actually took this program in and helped bring it to light in a different way too. I'll tell you in just a minute. But first of all, we can start with the teaching kitchen. This is our mobile teaching kitchen. We call it a pop-up. And I thought this was really great. This is Penn Medicine at Children's Healthcare of Pittsburgh. And this is the endocrinology team. They have a heat advisory committee. So they work together to do health education and advisory. And they loved the teaching kitchen so much that they ended up, Dr. Becker, she's a little tiny one in the middle, and Dr. Christina March, she's the endocrinology resident, endocrinology, and then the PAs. They love the teaching kitchen experience so much that they got grant funding for one, and they own it and they use it. We participate in it with the chefs that come through, but they run it. And they love it because they are dealing with kids with obesity. They are dealing with kids who don't eat the way they need to at home. And they realize that their medicine regimens are only as good as the way we can teach them to eat at home. And that is absolutely the biggest challenge. And so when they started this program, they really made some change. And I wanted to have some data on this one, but we did shut it down early because of COVID and they did not want to share the data. So, but I think they love it and they still use it, but they do it virtually. And then here's another example for someone's culinary medicine program vision for how they saw culinary medicine, and they looked at it in the way that mirrors the way culinary medicine certification comes out of our program here at Health Meets Food. And I thought, and this was accidental because they did not know about the curriculum until they met me. And then I said, oh my goodness, we need to talk. And you need to talk to Dr. Harlan and Carrie Dotson, because these are the people that you need to see. And they actually ended up deciding once they put me on the front line. They said, you go tell the digestive health physicians. They're like, you tell them. You tell them, you present to them. Let's see if they'll take the culinary medicine curriculum. So we prepared for that. We presented to the board and they ended up loving it. And as a matter of fact, they have now hired a chef. They have a dietitian manager, and they are both actually training in this program right now. So it's really, really exciting. And this was their sort of target populations for the program. And with that, we did this. This is how we started. You know, people say, how do you start? Well, I have a list. So you ask me the question on panel, I'll tell you how to get started. But we took them to places. This is in New York City. This is Viacom. This is the entertainment business. And they do all kinds of things. But we said, what do you want? How do you want this to work? What's your space? Number one, what's your space? If you don't have a space, forget your dream. You got to get a space. Space is important. And then, you know, what do you want? Do you want storage in there? Do you have storage? Do you need downdrafts? Is it just a regular conference room like this is? This isn't a completely portable kitchen. You could move every single table out of there and you could have a dance floor. I mean, you could do whatever you wanted to do in this room. It's incredible. Or like Google New York City, this is a fully built-in kitchen. You know, they have, it's the smallest rooms, about as big as this stage, but they have smart ways that they do things. Refrigeration under the space, under counter storage, open shelving. They have glass partitions between their eating space. Is that something you want, or do you need privacy for your patients? What's your curriculum look like? We have a variety of that. We can plan out what it looks like. And then last but not least, how do we get you the lessons? And a lot of times I think this cannot be underestimated. The culinary medicine curriculum here from Health Meets Food there's nothing else like it out there. And that's what I tell our clients. If you want this, it's done. It's here. It exists. You know, it's just a matter of tapping in and using it. And it's not expensive, which is even the crazier part of this. And so that is something that we do. We bridge it with our own curriculum so that we have that comprehensive full program. So I just wanted to conclude by saying that, you know, using a teaching kitchen in healthcare food service is really more than just teaching a recipe. It's more than just bringing education to the table. You can actually use teaching kitchens to create a fully immersive experience in the hospital for all of the people that are in there, moving forward, working for good, really setting the stage, and bringing culinary medicine to life. So with that, there is my information. If you have any need to reach out to me, please do. And I'm going to go ahead and conclude. Thank you.